Hi guys, my name is Adam Ford from Adam Songs. Honestly, it was a bit hard to come in and decided to take the vaccine. But when I think of everyone else and I think of the entertainment industry, I just had to decide, you know what, let me just take that chance and make that decision. So I just want to encourage everyone, that for some reason they want things to get back to normalcy, for whatever reason, I think they should take that chance and make that choice also.
Hi everyone, I'm Nadia Farrell Peanut, Head of the Adult Education Division.
Hi, my name is Miss Roach. I'm the Minister Secretary for Ministry of Governance.
Hi, I'm Consuelo Warrington, Administrative Assistant at the Establishment Personnel and Training Department.
Hi, I'm Charmaine Thomas from the Ministry of Governance.
Hi, I'm Bruna John Baptiste, Senior Clerk, Establishment Personnel and Training Department.
Hi, I'm Emmeline Augustine, Establishment. Just wanted to know that
I got vaccinated.
I got vaxxed.
I got vaccinated. I got vaccinated.
I got vaccinated.
I got vaxxed.
And I encourage you to get vaccinated.
Take the vaccine. Take the vaccine.
I think this is definitely the way so we can make it, so things can go back to normal,
I feel that getting vaccinated is something that's necessary for us to go back to normal like how things were before, and I'm excited to be one of the first people to get a new vaccine.
I'm a little nervous, but kind of excited at the same time.
I'm going to take my Covid-19 vaccine.
How do you feel about that?
I'm a little nervous, but I'm excited because I don't like injections.
I don't want to get COVID, so I'm really happy to take the vaccine. And I want everybody else to take the vaccine because it's very important. Get vaccinated!
Good evening, ladies and gentlemen. Welcome to this COVID-19 update. I'd like to welcome all listening and viewing public, Dominicans here, and of course, within the diaspora. This evening, we have the pleasure of once again having with us Dr. Shaluddin Ahmed, who is our national epidemiologist, Dr. Kivian Burnett, who is the coordinator of the National COVID-19 Vaccination Unit. And it also brings me great pleasure to welcome Mr. Glenn Etienne, the president of the Dominica Football Association, as well as Mr. Peter Ricketts, who is the president of the Dominica Amateur Basketball Association. Now, I'm sure with the mention of these two last names, you have recognized the underlying theme of this evening's briefing. But as always, we start with our statistics, and we welcome to the podium Dr. Ahmed.
Thank you, Ms. Harry. First of all, let me acknowledge the presence of my fellow presenters, Dr. Kivian Burnett, Coordinator, National COVID-19 Vaccination Unit, Mr. Glenn Etienne, President, Dominica Football Association, Mr. Peter Ricketts, President, Dominica Amateur Basketball Association. Media and fellow countrymen here and abroad, good evening to everyone. COVID-19 status update. As at November 11, 2021, our total number of new cases, 41. 39 of them are antigen positive and 2 are PCR positive. Total active cases, 373. Total recovered cases, 4,868. Total COVID-associated deaths, 35. Our vaccine coverage, as it stands, 53.4% of the target population took at least one dose of vaccine, and 49.3% of the target population are fully vaccinated. Let's look at the daily trend of COVID-19 cases. As you can see, the bar graph represents the daily positive cases. That's number of cases, that is. And then we have a blue line which represents weekly average. So if you look at the weekly average, you can see it is going downward. As of last week, we had 35 cases per day on average for that week. However, this week it went up a bit. It went to 40 cases so far, without excluding today's data. So we are yet to receive today and tomorrow's data in order to complete the full week. If you look at the linear trend, as you can see from the beginning to end, beginning meaning July 28 to November 11, the trend is relatively downward. So this is a good sign in the horizon. Let's look at the demographic of the new cases. Who are these people? Total number of cases, as I mentioned earlier, 41, and of them, about 5 of them were less than 12 years old age group. Then we had no cases between the age of 12 and 17. Then we had cases mostly, or most of them are between the age of 18 years and 65 years. And those who are over 65, very rare minimum, about 2 cases, and there were 1 that were not differentiated by the age group. It was incomplete data. So the most of the cases are coming from the age group of 18 and 65 years. And we are keeping eye on the group that we have recently introduced of vaccinating, that is 12 to 17 years. So we will be watching in coming weeks. In terms of severity of these new cases, in terms of mild, moderate, and severe, of those 41 cases, 5% were severe enough to be admitted at the St. James COVID Center. And then we had 46 of them moderate and 49 mild cases, or no symptoms at all. Let's look at the demographic of those active cases that we have so far. And these are those who are at the COVID care complex as of November 11, 2021. We had a total of 217 cases were admitted at the COVID care complex. Of these, proportion of cases by sex, as you can see, the female were more admitted than male, about 56 to 44%. In terms of our number of active cases by age group, the most of the cases again between the age of 18 and 59 years age group. Then we have less than 18 years age group also in the COVID care complex, as well as those who are 60 and over. These are about 25% of the cases. Now, in terms of the severity of the active cases at the COVID care complex, as of November 11, 2021, the proportion again, 5% are severe, 41% moderate, and for 54% of these cases are mild. Let's look at the positivity rate. It's very important in terms of determining that are we having indeed a low number of cases or not. So as it stands, as of yesterday actually, November 11, our positivity rate were at 6. However, there were one on November 10th, we had positivity rate higher than we expected. This could be due to the error in denominator. We have the incomplete data that represents, which we plan to rectify, and we are getting more information on that for that day. So other than that, as you can see, the average data, the linear data, you can see that its trend is downward, and it is stand at 6%. So positivity rate is 6%. Let's look at the characteristics of the COVID-associated death. As of November 11, we had 35 deaths. 17 of them are males and 18 females. Their age ranges from 40 to 107 years. Their median age is 80 years. Most of them had comorbid condition, that is 97% had underlying medical conditions, and 91% were unvaccinated. So in summary, our daily number of cases are low, and these low numbers are supported by the positivity rate, which is constant at this stage. It is stand at 6 as of yesterday. Most of the deaths are unvaccinated. Some of these cases were at the age of 40, 46, 51, 55, and 55 years old. Premature death. They were unvaccinated and had comorbid medical conditions. Again, this is to emphasize that vaccines save life. Vaccines work. Vaccination is needed to eliminate the community transmission. And for betterment of Dominica, we need you to get vaxxed. Again, public health measures. This is to say that our behavior has to change in terms of wearing the face mask, avoid social gatherings until there is no community transmission. We need to keep 6 feet distance, anyone other than household members, and frequent hand washing and sanitizing. With this, I thank you for your attention.
Our thanks to Dr. Shaluddin Ahmed, the national epidemiologist. Once again, a quick recap of the statistics. As of November 11th, the new cases at 41, active cases 373, and COVID-related deaths stand at 35 here in Dominica. We move on next to the president of the Dominica Football Association. We welcome Mr. Glenn Etienne.
Thank you, Ms. Ari. Dr. Shaluddin Ahmed, National Epidemiologist. Dr. Kian Burnett, Coordinator, National COVID-19 Vaccination Unit. Mr. Peter Ricketts, President, Dominica Amateur Basketball Association. The media, viewers, and listeners locally, regionally, and internationally. The Dominica Football Association is facing unprecedented times in the management of football on island. The COVID-19 pandemic has created many challenges that we have dealt with and we continue to deal with as an association, as it is our primary aim to develop football in the country. Firstly, we had to cancel the 2021 league season due to the increased number of cases on island and the existing state protocols which does not permit competitive play. However, we do understand that the health and safety of all players comes first. Secondly, our under-17 girls team were unable to participate in the CONCACAF under-17 qualifiers as some persons from the delegation contracted the virus during the time that they were due for travel. Thirdly, we are currently participating in the CONCACAF under-20 qualifiers in the Dominican Republic, and all our players and coaching staff are vaccinated. As an association, we are guided by the COVID-19 protocols of the state. Therefore, we have not imposed any vaccination mandate to our affiliates, but we encourage vaccination out of concern for our stakeholders and for the public health by extension. I am fully vaccinated and have not regretted getting vaxxed. As far as I can see, it works. We urge every one of you to stay safe, follow all the COVID-19 guidelines so that you can protect yourself and your families. I look forward to the day when football will be played in all football fields across the island, unaffected and with limited restrictions. We can get it done. We are a resilient people, so let's get it done. Thank you so much.
And our thanks to Mr. Glenn Etienne, President of the Dominica Football Association, and to the entire football fraternity. We know that it's not easy to juggle compliance and the desire to be competitive. So we appreciate the effort that has gone into, following the protocols and ensuring that your players, your athletes remain safe. We welcome to the podium next the President of the Dominica Amateur Basketball Association, Mr. Peter Ricketts.
Dr. Shalauddin Ahmed, National Epidemiologist, Mr. Glenn Etienne, President of the Dominica Football Association, Dr. Kevian Burnett, the Coordinator for the National Covid-19 Vaccination Unit, and to all the listeners and viewers, a warm good evening. COVID-19 brought all sporting activities to a screeching halt, basketball's National League included. We did not choose this pandemic. However, the Dominica Amateur Basketball Association has chosen to take action by engaging stakeholders such as our International Basketball Federation, FIBA, the Dominica Olympic Committee, the Ministry of Health, and the Sports Division, and others, in order to plot a pathway back to the courts. As a first step of our action plan, we partnered with the Ministry of Health's COVID-19 Vaccination Unit to host a successful virtual education session on Thursday, November 11th, to answer the questions and concerns of the basketball fraternity about the COVID-19 vaccines. Now, we seek to implement a restart and oversight committee. So we have engaged Sylvester John Baptist of the Red Cross to serve as our official COVID-19 compliance officer. Additionally, seeking out assistance from the Ministry of Health's COVID-19 Vaccination Unit, we'll be calling on the Dominica Amateur Basketball Association to present teams to serve and contribute on this committee so that we can gain insights as to the realities affecting the various teams and communities. This team is tasked to create a phased national restart plan. Furthermore, each community will be responsible for completing their own restart plan and submitting it to the Dominica Amateur Basketball Association for review and approval by the committee. Assessment tools will be provided in order to assist in doing so. Each team also has to prepare their own COVID-19 plan to show that they are prepared to take and implement the measures necessary to keep their athletes safe. Finally, we will seek the approval from the health authorities so that we can get back to the courts. So what do we know? We know that the various COVID-19 measures do work. Sanitization, social distancing, masks, frequent testing, and vaccinations. However, when it comes to close contact sports, there are only two measures that can be utilized: testing and vaccination. Testing, though not perfect, has over 90% efficacy for the antigen test, which we use here. What does that mean in terms of risk for close contact sports? It means that there's a 1 in 10 chance of a player who could be potentially infectious or positive receiving a false negative and coming to play at the games. This brings us to control measure number 2, vaccination. It is proved that the vaccinations reduce transmission and reduce the chance of a false negative player spreading the virus amongst the herd immunity of vaccinated players during close contact. So in the early phases of our restart plan, we will look to utilize all measures available to create a safe environment for our athletes. For over a month, we have been running a preparation camp for our under-23 3x3 team to compete against 23 other teams for the first time at the Junior Pan Am Games in Cali, Colombia from November 28th to 30th. All players and staff who participate in this preparation camp are fully vaccinated and must present a valid antigen test prior to the commencement of each weekly camp. We have had 0 incidents, a testament to the efficacy of testing coupled with vaccinations. So to the athletes who may be reluctant to getting vaccinated for various reasons, we ask that you critically think about your decision and weigh in the opportunity cost. Opportunity cost is defined as a loss of value or benefit that would be incurred by engaging in an activity. Under 23 players, we have had under 23 players eligible to compete at the Junior Pan Am Games who were not vaccinated and will miss this opportunity to potentially be discovered on the international stage. So in conclusion, enough time has passed for everyone to observe the many vaccinated Dominicans who are not affected by adverse reactions to the vaccines. Ultimately, we must convince the local health authorities that we are capable of achieving safe play of basketball amidst this global pandemic. I am vaccinated, and the DABA is doing its part. So it's time for you, the athletes, to get vaccinated as to strengthen our case for the return of basketball in Dominica. I thank you.
And our thanks to the president of the Dominica Amateur Basketball Association, Mr. Peter Ricketts. And let me commend the DABA on this initiative for the restart of basketball and the development of COVID-19 plans for clubs and teams. Of course, that ensures a little bit more responsibility and accountability on the part of the teams and clubs as the association does its part in conjunction with the Ministry of Health. So thank you very much, Mr. Ricketts. And finally, this evening, we welcome the coordinator of the National COVID-19 Vaccination Unit, Dr. Kivian Burnett.
Thank you, Ms. Hari. I want to acknowledge the presence of my esteemed colleague, Dr. Shaluddin Ahmed, the National Epidemiologist, Mr. Glenn Etienne, the President of the Dominica Football Association, Mr. Peter Ricketts, the President of the Dominica Amateur Basketball Association, media houses, Dominicans listening at home and abroad, a pleasant good evening to you. The COVID-19 vaccination unit continues in its efforts to conduct sensitization to the general public on the importance of choosing to get vaccinated and continues to implement new activities and initiatives geared to accomplishing the goal of herd immunity in Dominica. Paramount to this, the unit appreciates the acceptance of the COVID-19 vaccine is the clear prerequisite. As I've said on a number of occasions, vaccines will not end the pandemic, is vaccination. As at Wednesday, November 10th, 2021, the unit had administered a total of 11,982 vaccines to the Dominican population since its inception. With the introduction of the Pfizer vaccine and the increased national sensitization campaign, we have seen a clear increase in vaccinations, which means persons have been more receptive to the vaccine, however, not at the pace that we anticipated at first. If we are to attain herd immunity, we must do much more better than this. To provide you with an overview, to date, the unit has the most reception or seen the most reception of the vaccine within the Roseau district, which accounts to 42% of total vaccines administered, with Portsmouth and St. Joseph at 13 and 12% respectively. As you can see on your screen, this graph represents an idea of the districts which needs an increase in vaccinations. One of the unit's main targets is to deal with students or teens within the age range of 12 to 17. With the onset of the Pfizer rollout campaign, various high schools were visited to ensure the accessibility of vaccines remained a top priority. We commend parents who made the decision to get their children vaccinated. However, much more is required if we are to return to a state of normalcy. Presently, only 30 students or 30 children at the age between 12 to 17 have been vaccinated. Our total target population in this group is 5,421, with the total inoculated at 1,602. To give you a clear picture as it relates to the students or schools respectively, the following school has been highlighted at the highest turnout in terms of vaccinations. We have the Isaiah Thomas Secondary at 56%, the Pierre Charles Secondary in Grand Bay at 43%, the Dominica Community High School at 39%, the Cassibus Secondary at 34%, and the Convent High School at 42%. 216 vaccines were administered at various health centers across the island. However, on the prerequisition form, data that captures the respective schools were not documented, but this information is being rectified as we speak. Making a decision to get vaccinated not only protects you, your friends, your families, but it protects your community, your church, social groups, your sports club, your school, and so much more. All COVID-19 vaccines are effective and reduce the chances of severe symptoms, hospitalizations, and deaths. We have clearly seen the indications of the efficiency of the vaccine among the COVID-19 patients on island. We have seen significant reduction in severity of symptoms and quicker recovery time. Important to the unit is understanding and ensuring that persons are able to access COVID-19 vaccines, and as such, we have now received 2 mobile vehicles that will traverse around the island to administer vaccines. These vehicles were donated to the COVID-19 unit today by the Pan-American Health Association, and we would like to express our sincere gratitude to PAO in their continued efforts in assisting Dominica in the fight against COVID-19 and by extension to improve health and life to the general public of Dominica. Sorry, the quality of life, that is. My apologies. The unit will not only administer vaccines, but we will also sensitize persons on the importance of getting vaccinated, as well as dispelling the myths and misconceptions that one may have. We urge you to look out for our branded mobile units, as we will be visiting you somewhere in your district. In an attempt to continue to push forward our objective to ensuring equitable access to vaccines to anyone who is willing to receive a vaccine, we have now partnered with several private entities, or even private doctors, I must say. Dr. Kervin Ferrara, an obstetrician gynecologist at Adam Healthcare Services, Monday to Saturdays, as well as Dr. Sherizata Joseph on Mondays, Wednesdays, Fridays, and Saturdays. These new sites will be commenced on December 1st. In light of International Men Day on November 19th, the unit has also partners with the Bureau of Gender Affairs of the Ministry of Social Services, Community Development, and Gender Affairs, that's twice, to collaborate drives in targeting men in our society. On November 23rd, 24th, and 25th, we will engage in a 3-day island tour to encourage men to get vaccinated to protect themselves and their families. These are as follows. So on the 23rd, that is Tuesday, the 23rd of November, the first bus would be in Kingshill, Citronet, Fortney, Castle Comfort, Wallhouse, Beaubois, Scottshead. Bus number 2, Newtown, Loubier, Fort Bower, Port Michel, Egliston, and Girardale. Wednesday the 24th, the first bus would be in Salisbury, Dubla, Portsmouth, Cottage, Tuckery, and Capuchin. Bus number 2 on Wednesday the 24th as well, Goodwill, the community of Tarish Pit, Gotha, Stock Farm, Belvirol, Silver Lake, Trafalgar, and Loda. On Thursday the 25th, bus 1 would be in Woodford Hill, Calibishi, Wesley, Marigot, and the Kainago territory. Bus number 2 on the 25th as well will be in Cassibruce, Dalis, Laplane, River Cyric, and Monjon. The government has ensured that all vaccines are available completely free of charge to everyone wishing to get vaccinated. I repeat, vaccines in Dominica are administered free of charge. This in itself displays the dedication and the willingness of the government to ensure that the Dominican population is protected from this dreaded COVID-19 virus. In the upcoming weeks, we anticipate the addition of a variety of vaccines offered free of charge once more. So the onus is on you to get vaccinated, to make the decision to protect yourself, your livelihood, and most of all, your nation. I thank you. Good evening.
Thank you so much, Dr. Kevian Burnett, who is the coordinator of the National COVID-19 Vaccination Unit. I'd like to extend our gratitude to you and your team for your rigorous work so far. You have taken on initiatives to ensure that vaccinations have gotten to the most rural areas in Dominica. So we'd like to commend you for your work in helping to get everyone vaxxed and protected. I'd also like to echo our gratitude to the Pan American Health Organization for the kind contributions made earlier today of the 2 buses, the medical supplies and equipment. Of course, that will facilitate vaccination across the island, and your continued support in this fight is greatly appreciated. Ladies and gentlemen, although, as Dr. Ahmed mentioned, we've seen a downward trend in our infection rate here in Dominica, this is no reason to become complacent. As we head into the weekend, I encourage you to continue to adhere to the health and safety protocols. Of course, those work in conjunction with vaccination and routine testing to keep you safe and protected, to protect the most vulnerable among us. So we ask you to remain safe this weekend, And we thank you, as always, for your time and your attention. Good evening.
Hi guys, my name is Adam Ford from Adam Songs. Honestly, it was a bit hard to come in and decided to take the vaccine. But when I think of everyone else and I think of the entertainment industry, I just had to decide, you know what, let me just take that chance and make that decision. So I just want to encourage everyone, that for some reason they want things to get back to normalcy, for whatever reason, I think they should take that chance and make that choice also.
Hi everyone, I'm Nadia Farrell Peanut, head of the Adult Education Division.
Hi, my name is Miss Roach. I'm the Minister Secretary for Ministry of Governance.
Hi, I'm Consuelo Warrington, Administrative Assistant at the Establishment Personnel and Training Department.
Hi, I'm Shamin Thomas from the Ministry of Governance.
Hi, I'm Bruna Jean-Baptiste, Senior Clerk, Establishment Personnel and Training Department.
Hi, I'm Emmeline Augustine, Establishment. Just wanted to know that
I got vaccinated.
I got vaxxed.
I got vaccinated. I got vaccinated.
I got vaccinated.
I got vaxxed.
And I encourage you to get vaccinated.
Take the vaccine. Take the vaccine. Need it.
I think this is definitely the way so we can make it, so things can go back to normal,
I feel that getting vaccinated is something that's necessary for us to go back to normal like how things were before, and I'm excited to be one of the first people to get a new vaccine.
I'm a little nervous, but kind of excited at the same time.
I'm here to take my COVID-19 vaccine.
How do you feel about that?
I'm a little nervous, but I'm excited because I don't know I can catch it.
I don't want to get COVID, so I'm really happy to take the vaccine. And I want everybody else to take the vaccine because it's very important.